Welcome, everyone, to the Winning U.S. Open. I'm your host, Ramon Osa, along with my co-host, Mark Jeffrey. And today, guys, we have an amazing guest, Dr. Erin Boynton, who has literally saved my tennis life. So I had a torn rotator cuff, torn labrum, tendinosis, every three-syllable word under the sun. And I gave my MRI to Erin, and she says, you don't have to worry about it. Do these corrective exercises, which you're going to find out about in a second. And a year later, I'm out hitting serves with my wife. Erin has been the consultant to the WTA, the Toronto Blue Jays. She is a board certified orthopedic surgeon. She is a Canada's plus 55 champion. And we're just so fortunate to have you today, Erin. Thank you for being with us.
Oh, it's my pleasure. Anything to keep more people playing tennis. I gotta make sure I got good competition out there.
And she's also our most loved student. Amongst all our loving students, she's our most loved student, I think.
That's
thank
amazing.
You. I love you guys.
So today, guys, the topic is about foundational fitness. And as you're watching these amazing athletes at the U.S. Open, you're seeing some injuries pop up. And Erin, I know you've got very intimate knowledge about all of the trials and tribulations tennis players go through physically, as well as mentally and emotionally, focusing on physical today. And I guess if you could just start us off with what we were talking about before we went live about balancing the body and how that has such a monumental impact on whether or not we're at risk for injuries, that would be amazing.
Sure. Well, to start with, I think, as an orthopedic surgeon, I'm interested in the muscles, bones, joints, tendons, and I specialize in sports. And when I first started out many, many years ago, my craft is surgery. And so I was trained to look at, torn tendon, fix it. But I very quickly realized that if we didn't understand why the tendon tore, why the body part broke down, and we went and we did surgery, then the surgery would be successful for a short period of time. If we didn't fix why it broke, it would just break again. And I really observed this with working with professional athletes. I was the doctor for the Toronto Blue Jays and pitchers in particular. We would do these operations to decompress the tendon, remove a little spur, but then the athlete couldn't get out and perform the way that they'd been performing, say, 5 years before they had their problem. And what I started to realize is that we had to get to the root problem of how the wear and tear injury had developed over time, and we had to fix that. And that involved changing how you move your body. I had over a 2-year waiting list for surgery. So somebody would come in to my office with your problem, Ramon. They'd have partial tear of the rotator cuff. They'd have a labral tear. They'd done physical therapy. They'd had cortisone injections, and they had a lot of pain. And I said, okay, well, we're going to fix your labrum and we'll decompress your tendon. And they're like, great. When are we going to do it? I said, well, come back in 2 years. And they're like, what the hell am I going to do for 2 years? So I said, okay, let's try to fix why you broke. So I started to get them to do exercises to change how they were stressing their shoulder. I said, come back in 3 months and we'll see how you're doing. And we'll repeat MRIs to make sure that the pathology isn't getting worse. And if really things get bad, we'll try and fit you in somewhere. And to my very pleasant surprise, about 70% of my patients got better, didn't even want to have an operation. And those that then did need surgery got a far better result because they'd fixed why they had broken. So I became very interested in understanding what's the basic foundation of movement that we need? What are the prerequisites for motion that we must have to prevent injury? And that is what I've really studied over the last 30 years and developed a method with Eric Wong, who's a kinesiologist. And we've put together programs to help people to always restore this foundation for movement, which really is a balanced state. And one of the biggest problems when we play a sport like tennis, it's very repetitive. It's one side of your body. You're doing these motions over and over and over again. And you can imagine if your body was like the tire of a car, and it's spinning, the wheels are spinning, and you're going down the road, you eventually wear out the little threads in the tire, and eventually a hole can develop there. The big difference between our body and a car is that we can repair. So the car can't repair, but our body can. So if you go out and you have like a little micro injury that happens after you play a match during the day, then that night, if you eat properly and you get your sleep and you rest, then the body can repair. But one thing that happens is that we develop imbalances. So when we throw our arm to throw a serve, hit a serve, we get some tightness, and then that changes how things move. So you can imagine the tire, instead of being aligned, is now out of alignment. And that accelerates the wear and tear. And so if you don't fix the alignment, which is one of the principles of the foundation, then the wear and tear continues. So the key thing really is to go and play tennis, create imbalance, create wear and tear, but then at the end of the day, you have to recreate balance and give your body a chance to recover and heal. And it's lacking, seriously lacking in tennis, even at the professional level. It's shocking to me how the players don't have this foundation for movement.
Well, Erin, I've been through several of the programs that you spoke of, and one thing that you have available is called the ROM Coach, and ROM stands for range of movement, I'm guessing, range of motion. And so, guys,
I always thought it was his name.
That's funny. And so, you guys, you should go download this thing. If you're playing tennis, the ROM Coach is a free app on your phone. You can get it at the App Store, and it's spelled ROM. And it's brilliant because not only does it give you an assessment of kind of what your biological movement age is, it shows you sort of where your tightnesses, where your weaknesses, where you're susceptible to injury. But then what's brilliant about it is it gives you a very simple, very structured routine that you can do every single day in a few minutes that begins to restore your range of motion and begins to strengthen those muscles that maybe have gotten sleepy over the years. And Erin's partner, Dr. Erin Wong, I think, no, he's not a doctor, but he should be a doctor. He is a genius, and this is a free application. So guys, go download that. It's at the App Store. It's totally free, and it'll help you so much. Mark, I'd like to kick it over to you if you have a question for Dr. Erin.
Yeah, thank you.
To have her.
So we're in the midst of the US Open. All the tennis players with their teams have been getting themselves ready for the US Open because it's their biggest payday. And the deeper in the tournament, the bigger the payday. But are they overtraining and training the apex of the pyramid to the detriment of the foundational fitness?
Well, the short answer is yes. But let me just explain a little bit about what the foundation is in the pyramid. So imagine you have a table with four legs. The top of that table is your foundation for movement. And the four legs are our four pillars. Those are the four requirements of your body that you need in order to have a stable foundation. So those four are good tissue quality, alignment, activation of the right muscles, and then active range of motion. And so those four requirements are necessary. So we go and we play tennis. We get tight, say at the back of our shoulder gets depressed. We lose some of our forward flexion. So we lose our foundation for movement. Now, sitting on top of that table is a performance pyramid. And that pyramid is basically prerequisites, again, of what your body requires in order to perform. So first you have to establish endurance of your foundational movements. then you build strength, then you build power and speed. And the biggest problem I see, there's two main reasons people get injured. One is they don't have a foundation for movement. And then the second is they go up that performance pyramid too quickly. So they're coming back from injury and they try to sprint before they can crawl. And it's that simple. That's orthopedic surgery in a nutshell. Do you have a foundation for movement? Are you trying to do too much that your body's not ready to do? And so what I find is that the vast majority, like I did the orthopedic physicals screening exam for the tour last year, and not one of the professional athletes had a foundation for movement. Now,
wow,
yeah,
sure.
not one. And so you can imagine if you've got this performance pyramid sitting on top of a table and you only have two legs on the table, what's going to happen? It's going to fall over. So the goal really is you go and you play, you get tired, a muscle shuts down, it stops working because you've been playing 5 hours or 4 hours, 3 hours, however many, hours that you've been doing it. When that muscle goes to sleep, your body has to compensate. When your body has to compensate and a muscle's doing a job it's not meant to do, problems start to happen. And that's when we really break down. So you do that when you're playing, that's fine. So long as after you play, you go and you rebalance. So the whole goal is to restore those 4 pillars. You want to do a warm-up before you play to make sure that the 4 pillars are in place. So if, say, you've got a tightness at the back of your shoulder, you might do some active self-myofascial release. I'm going to talk about stretching versus active, so you're not just passively pulling your arm across your body like this. That's passive. I'm not using a muscle. Versus actively using my arm with pressure on a part of my shoulder is very different. It changes the biological signals and turns things on so that you're better prepared to play. So you do your warm up to make sure all 4 of your pillars are in place. Then you
Can
go
you tell me the 4 pillars again, just for me? What everybody else?
Tissue quality. So you could have, this tightness in your shoulder or tightness in your quad. So you want to release that tightness with an active self-myofascial release. The key is then to activate a muscle right after you release it. So say it's your quad. We release it, we do some foam rolling, and then you're going to do an isometric contraction to activate the muscle. Then you're going to make sure that your body is aligned properly, because if you don't have proper alignment, the muscles, it changes the resting length of the muscles. And when you change the resting length of the muscle, it may not be able to turn on, or it may not be able to work as properly. And then finally is having that full active range of motion. So tissue quality, alignment, activation of the right muscles, and active range of motion are the 4 pillars.
Okay.
So it's like warming your car up before you go driving out in a snowstorm. You want to make sure the engine's going, everything is lined up as best you can. Go out, drive that car, run out of gas, do whatever you want to do.
And Erin, sorry to interrupt you. You've got a program on the ROM Coach that is a tennis specific warm up that takes you exactly through these 4 stages. Is that right?
We hit the 4. So there is yes. So I can, it's hard to see. I'm sorry I can't share my screen here. But if you, I don't know if you guys can see, this is me working backwards. ROM,
Yep.
ROM, that's the app.
Yeah.
ROM Coach. Then you go into the app and you can see the library. And then there's single exercises and routines. Just touch on routines. And then you can search, and you just search tennis. And we have in there a series of, there's me. We have a series of programs. So we've got, for example, a warm up. We've got a cool down. We have a full body routine, an upper extremity and lower extremity. And so for the tennis prep, if I hit on that.
Welcome to the pre-tennis prep.
There is a list of exercises here, and these hit all of the parts of the body that tend to be a problem for tennis players, and we get them turned on. And there's a little video for each of these. So I highly recommend it. We've gone, so this is something that will help you to prepare your body to go and play. And then you can do one of the routines afterwards to kind of rebalance your body. And then it depends a little bit on what your specific issues are. You may choose another routine to throw in there.
And you've got various programs that are really focused on, let's say if someone's having low back issues, or if they're having, like me, I had a shoulder problem, got a program called Shoulder Control, which is genius. It's probably a little bit deeper than we can go into now, but getting into disassociating movement patterns, activation through the full range is just brilliant. We've got a question from Susan. Hey, Susan. I met Susan actually at a USPTA conference. So amazing. Hope you're doing well, Susan. She says, ask her about the Rubbermaid trick for tennis elbow. It's incredible. What is the Rubbermaid trick, Erin?
I can't remember, Susan. You're going to have to give me a clue. What is my Rubbermaid trick?
It was so amazing that she remembered it. And we
she
finally got Erin.
While Susan's typing in, let me just ask you about the Grand Slams, and then about athletes that might have done the recent World Championships. So it's 14 days of competition for those that get through to the very end, rather than 7 days. They do intensive matches, may or may not have a day's break and come back. And at the end, invariably, you've got 36-year-old, I think, Djokovic. Talk me through, if you would, the strains on the body as you go deeper into a tournament, and then whether Djokovic has a foundation for fitness.
Well, I haven't examined him, but when I just watch him move, I would say that he does. Because I look at his posture and alignment. So you compare Djokovic to Kyrgios. Kyrgios does not have a foundation for movement. He's, hunched over, his shoulders are rounded, he's got a tucked pelvis. So I know that he cannot be using the muscles that he needs to be using around his shoulder or around his hips. Whereas Djokovic, his shoulders are level. You often see him kind of tucking his chin. He's not forward like this.
Yeah.
Forward carriage. This is a really important movement. When your head is forward like this and your jaw sits in front of your collarbones, we call that forward head posture. I know you can't be using your shoulder blade muscles properly. It actually shuts off the serratus. It shuts off your lower trap. It prevents your thoracic spine from moving properly. You almost see him when he goes to serve. He almost does like a little chin tuck. And I think at one point he might have had some neck pain. I remember a few years ago seeing him getting treated for neck and shoulders. So, he's doing something to address that. And then you've seen the pictures of his flexibility. He's got amazing range of motion and he has glutes. So I would say he does have a foundation for movement, and he's clearly doing something right with his recovery. And I think, recovery is not just physical, it's the mental aspect. And it's nutrition, it's getting your sleep, having the physical therapists and massage therapists there to work on your tissue quality so they can be releasing tight muscles is all a benefit. And of course, nutrition is critical. So, he talks about all of these things, and I think that he does a very good job of checking all the boxes.
Erin, I have a question. This is maybe a little bit off topic about nutrition, because I think so many people, it's such a polarizing topic. And you've got someone like Djokovic who eats a vegan diet, and then you've got, other people who may be eating, primarily meat. How do you sort of look at that, and what do you do? I'm just genuinely curious.
I think everybody needs to find out what works best for themselves. I personally try to avoid processed food. I try to avoid sugar, gluten, milk. I avoid a lot of things now. But I eat a lot of vegetables. I do eat meat. I eat fish, probably a lot more fish than meat, because that feels good for me. I find if I eat meat from certain stores, I feel weird. Like I get a really strange sensation in my body, and I can't eat processed things. If I eat them, I feel crummy. So basically, I've tried to become very eating whole foods, real food. But as far as, what do I tell people? I do believe in an anti-inflammatory diet. I think sugar is very inflaming. Wheat can be very inflaming for some people. But you see, I could eat anything and everything when I was young. Now that I've gotten older, I think I've developed sensitivities. And so I think it's just important for each individual to be very aware of how they feel when they eat and what works for them and what doesn't, and to have it looked at, because it's very important. Like, you think if you don't eat properly, you don't give yourselves the building blocks to regenerate, and you're then constantly in a degenerative process, and you can't heal, you can't repair, you can't build. And it's like trying to run that car without any gas. So nutrition is critical. And I'm actually shocked that our medical profession doesn't really talk about this. Like, there should be surgical nutrition.
Sure. This is a cheeky question, Erin. Dr. B. Let me not call you Erin. Let me call you Dr. B. You've heard the phrase of cobblers and shoes, yes?
Yes.
Cobblers always have holes in their shoes. So you know everything. When was the last time you had an injury in a tournament? What's your regime prior to and during something like the World Championships?
I am really disciplined. I did have a bit of neck pain actually in a tournament in Mont Tremblant, which I think had to do with improving my thoracic spine mobility. Like, sometimes when you improve mobility in one part of your body, it affects the other. But now I'm very good. I was still able to compete. It did affect me when I was serving. But, I'm really proud of how my body held up during the World Championships. It's really intense. Like, I was on the court for 6 hours one day in 100-degree temperature, and was able to get out and play the next day in my singles. And I could have played doubles. Thankfully, I didn't have to. But I get up, I make sure that I eat well. I make sure I'm hydrated. Hydration is another really important component to competing. If you're dehydrated, it not only affects your musculoskeletal system, but it affects your brain. And if you're not then thinking clearly and moving properly, it's going to change the load on your tissues. So I eat, I hydrate, I make sure that I do my routine, and I have kind of rotating little things. Like, sometimes my knees are a little sore, sometimes my quads are a bit tight, sometimes my back is a little this, a little that. And it just depends on a lot, I think, on the match that I've had the day before. Was I in a long plane ride? So I just kind of go to whatever part of my body is maybe feeling a little bit like it needs a little extra love, and I do a routine to fix it before it becomes broken. And I'm always trying to stay a step ahead of it.
It strikes me as you're speaking that having you in their hip pocket on the Wrong Coach app is exactly what they've got. They've got Dr. B that they can just go to the app and go, yeah, my glutes are a little bit sore. My glutes aren't firing. Oof. And there's Dr. B going, here's what you should do, boy.
Yeah, for sure. For sure. I mean, this is because I live it. Like, I use the ROM Coach app every day.
Wow.
Yeah,
there are so few cobblers that have proper shoes. Well done, Dr. B.
So if you guys are watching this right now, go download the ROM Coach. It's in the App Store. It's spelled below, stands for range of motion. It's free, and the program that you get in there, it really is invaluable. a couple more minutes with Dr. Erin. Guys, if you guys are tuning into this now or later, and you have any specific questions for Dr. Erin, you can put them in the comments. We can answer those for you. And if it's in the replay, we'll get back to you on that. So, Erin, again, thank you so much for being here. What is something that you feel like all tennis players should be doing maybe on a daily basis? Give us like 2 or 3 things that if you did this every day, you would set yourself up for success physically.
Well, number one, it's doing a routine. It doesn't have to be the ROM coach, but of course, I think ours is like the best. The biggest problem I hear, people stretch. Tennis players stretch. Now, there's a problem with stretching, and let's say your glutes are tight. So you go home and you stretch your glute. Well, the question I ask is, why is your glute tight? Now, people say, well, I had a long match. But okay, it could be that you had a long match, but usually a muscle is tight because some other muscle has turned off. And usually your butt is tight because of a muscle called piriformis. And so when your gluteus maximus is
well,
then the piriformis has to work double hard, and it's not biomechanically meant to do the job of the gluteus maximus. So that poor little guy's in there working like crazy, and it just gets like this, and it becomes very painful. And sometimes you can even get sciatica with it. So then people say, okay, my piriformis is tight. So they go home and they stretch it. And then they maybe feel better for an hour. But then 2 hours later, the piriformis is tight again. And the next time you play, the piriformis is tight again. And that's because you haven't addressed the root reason why that muscle is tight. So the stretching doesn't work for a couple of reasons. One, if you stretch the tissue, you stretch that muscle, you don't, and especially if you passively stretch it, you don't have control of that new length of the muscle. So you've got this extra range of motion, but you don't have control of it, and your brain doesn't like that. So then it makes that muscle tight again. So there's a neurologic reason. You actually make yourself susceptible to injury because you've got this extra length of muscle without control of your body. So the second reason I don't like passive stretching is that if you have a little injury, and imagine you've got a rope with a little tear in the rope. You can see the fraying of the rope, and you've got tension on that rope. If you pull harder on it, where is that rope going to break? It's going to break right where it's fraying. It's not going to stretch the area that's healthy. So if you've got a little injury in the area and you're passively stretching, the lengthening is going to happen through the path of least resistance, which is where the injury is. And so it's key that you actively regain your range of motion so that you have control and you own that range, and you'll find that you don't have to stretch. Like I used to stretch 100 years ago, and now I don't need to stretch anymore because what I do is I do the active self-myofascial release. So I do some rolling, but then I turn the right muscle on, and then the body goes, oh, I don't have to be tight. Because the right muscle's doing its job.
This is industry shocking stuff.
Where does in terms of strength training, this is probably a deeper question we can get into now, but should tennis players be using progressive overload? Should they be training to failure? Where does that, because you look at Rafa Nadal and then you look at someone like Medvedev, who have two totally different body types, and is there an optimal sort of muscle to size ratio, or is it different?
It's different for every person. Like I've been working my buns off to get, big and beefy, but I never will because I'm more ectomorphic. But I do believe in strength training for sure. But you need to do that strength training on top of a solid foundation. If you do strength training on a unstable foundation, you're going to exacerbate any issues that you have and create new ones. So, and tennis is a sport that's very challenging because there's not really a good off season. With most sports, we do what's called periodization. So you do your strength building, where you'd be overloading the muscles in the off season. Then during the season, you maintain, and then you have a rest period. It's very challenging to get this in tennis because they basically have a month off, and most of the time they're off playing exhibitions and traveling around, and that's not rest. It's not really and it's you really need to rest actually at some point instead of trying to strengthen and really build your strength. So it's a challenge. I think, in my opinion, the biggest problem with tennis is lack of recovery. You could do a little mini training block. If you lose at the first round of Wimbledon, you've got now 2 weeks. You could do a little mini training block where you progressively build some strength, but there's not enough recovery time.
We could talk for hours on this.
Hours. Yeah, I have a million questions, but we want to be very go ahead, Mark.
Well, I just wanted to say that clearly, listening to you, the older you get, the more we are carrying niggling long-term injuries onto court, the more that we are bandaging our knees up, etc., and elbows. You can just see it everywhere. So what you're talking about and your specialism and the wrong coach should become a super weapon for tennis players the older they get.
Yeah, there's no question. A very common scenario that I hear in my office is that, say, somebody has tennis elbow and they've got pain. They've gotten to a point where they can't play. So the doctor says, okay, take some time off. So they take some time off and they rest and they feel better. So a month later, they go back out on the court and they start playing. And within days, the pain comes back. And that's because they haven't really addressed their foundation for movement. The tissue quality may have improved. Like, say there was a bit of a tear and a bit of inflammation. Well, maybe that's improved, but they've not done anything to restore alignment. If you take the car again, the example of the wheels, and you've got a hole in a tire and you've got malalignment of the front wheels. You say, okay, I'm going to stop driving the car. So you stop driving the car, you stop progressing the tear in the hole in the tire. As soon as you start driving again, though, if you haven't corrected the alignment, the tear is going to continue to worsen. And you could even replace the tire. Say, okay, I'm going to put a new tire on there. But if you don't change the alignment, the wheel's going to just tear again. So rest is important, but you really have to get to the root cause. You have to restore that foundation for movement. And that's the biggest problem I see. Everybody wants a quick fix. They want a cortisone injection, a PRP injection, surgery, this laser, this whatever. All of these things are Band-Aids. And yes, they can be very beneficial because they can help with tissue quality, which is great. But if you don't fix the other pillars, the problem is just going to come back.
So last question, Ramon, before we die down, or a statement. There must be on tour lots of experts that are patching people up instantly to get them back on the court without solving the root problem, and thereby building up a problem so it becomes a big problem, and then they lose their livelihood.
It's shocking. It's kind of it's a bit of a wild west out there. I think one of the reasons is that tennis is an individual sport. It's not like working with a team like with the Blue Jays, where the players are basically owned in a way by the team, and they've got to come in and they got to do the nutrition and they got to follow the protocols. The girls, I find that they're searching for the answer. They got to get back out on the court and they've got to do it quickly. And it's always just a little Band-Aid, just putting your finger in the dike and not really fixing the hole. And it's something that it's a challenge. And I would love to try and make a difference there. I'm trying to educate right now on establishing a foundation for movement and the importance of that. And, we could make a huge inroads, even in college tennis, with tennis coaches in general, getting them to teach their players, hey, do this 10 minutes before you come on the court. It means tennis for life instead of tennis for
5 minutes.
Yes.
Erin,
Wow.
We are so fortunate to have you today, and I could talk to you for hours. I know Mark feels the same way. You guys, if you're watching this, share this with somebody who needs it. because there are a lot of people out there that are suffering unnecessary injuries. And download the ROM Coach in the App Store. It'll really be beneficial for you and your players. Erin, thank you so much for being here today. Really appreciate having you.
Well, it's my pleasure. And thank you guys for all that you do. You know, you've really made a big difference in my life and my tennis life, and not just my tennis life in general. It's awesome. So keep on going, guys.
Awesome. Thanks, guys. Have a great day.
Rather than Dr. B. Cheers, Erin. Thank you so much.
Bye, guys. Thank you.